Another day, another story. Work health and safety, WHS, also known as occupational health and safety, OHS, refers to the policies, procedures, and practices in place to ensure the health, safety, and well-being of workers in the workplace. This includes the physical and mental health of workers, as well as their safety in performing their job tasks. WHS is important because it helps to prevent workplace injuries and illnesses, which can have serious consequences for both workers and employers. Workplace injuries and illnesses can lead to pain and suffering for workers, as well as lost income, reduced productivity, and increased costs for employers. Some key aspects of WHS include hazard identification. This involves identifying and assessing potential hazards in the workplace, such as dangerous machinery, hazardous substances, or unsafe work practices. Risk assessment. This involves assessing the likelihood and severity of harm from each identified hazard and developing measures to control or eliminate the risk. Training and instruction. This involves providing workers with the knowledge, skills, and resources they need to work safely and prevent injuries and illnesses. Equipment and facilities. This involves providing appropriate equipment and facilities to ensure that workers can work safely and efficiently. Consultation and communication. This involves involving workers in WHS decision-making and ensuring that communication channels are open and effective. Monitoring and review. This involves monitoring the effectiveness of WHS measures and reviewing them regularly to ensure that they continue to meet the needs of the workplace. Overall, WHS is important for creating a safe and healthy workplace, preventing injuries and illnesses, and promoting the well-being of workers. It is the responsibility of employers and workers alike to ensure that WHS measures are in place and effective. Manual handling is a key part of work health and safety, WHS, because it is one of the most common causes of workplace injuries and illnesses. Manual handling involves the lifting, carrying, pushing, or pulling of heavy loads, which can place significant strain on the body and increase the risk of injury. As part of WHS, employers have a responsibility to ensure that manual handling tasks are performed safely and that workers are trained in safe manual handling techniques. This may involve identifying manual handling hazards. Employers must assess the risks associated with manual handling tasks and take steps to eliminate or control these risks. Providing appropriate training. Employers must ensure that workers are trained in safe manual handling techniques, including how to lift and carry heavy loads, how to use lifting aids and equipment, and how to assess the risks associated with manual handling tasks. Providing appropriate equipment. Employers must provide appropriate equipment and resources to enable workers to perform manual handling tasks safely, such as trolleys, lifting aids, and personal protective equipment, PPE. Monitoring and review. Employers must monitor manual handling tasks and review their effectiveness regularly to ensure that workers are not exposed to unnecessary risks. Failure to manage manual handling risks can result in serious workplace injuries, such as back injuries, strains, and sprains, which can have long-term consequences for workers and their ability to work. Therefore, it is essential that manual handling is managed as part of a broader WHS program to ensure the health and safety of workers. Manual handling tasks can be classified into different types based on the nature of the task and the type of load being handled. Here are some common types of manual handling tasks. Repetitive handling. This involves performing the same manual handling task repeatedly, such as lifting boxes onto a conveyor belt. Awkward handling. This involves handling loads that are difficult to grip, carry, or maneuver due to their shape, size, or weight, such as large and heavy furniture. One-handed handling. This involves handling loads with only one hand, such as holding a door open while carrying a box. Team handling. This involves handling loads with the help of other people, such as carrying a heavy object together. Container handling. This involves handling loads that are contained in a specific type of container, such as lifting barrels or drums. Live animals handling. This involves handling animals, such as lifting a heavy animal or restraining it during a medical procedure. All of these manual handling tasks can pose a risk of injury if not done properly. Therefore, it is important to use safe manual handling techniques, such as assessing the load and task, using appropriate equipment, maintaining good posture and body position, keeping the load close to the body, avoiding twisting or reaching out while carrying the load, and taking regular breaks and alternating between different tasks to avoid overexertion and fatigue. Manual handling tasks are common in many different workplaces and industries. Some examples of manual handling tasks that may be performed in the workplace include lifting and carrying heavy boxes or packages, such as in a warehouse or shipping facility. Moving heavy equipment or tools, such as in a construction or manufacturing setting. Pushing and pulling heavy carts or trolleys, such as in a hospital or retail setting. Handling and lifting patients or residents, such as in a healthcare or nursing home setting. Sorting and stacking materials, such as in a warehouse or distribution center. Assembling or disassembling products, such as in a manufacturing or production line. All of these manual handling tasks can pose a risk of injury if not done properly. Therefore, it is important for employers to provide appropriate training to their employees on safe manual handling techniques and to ensure that the workplace is designed to minimize the risk of injury from manual handling tasks. This can include providing appropriate equipment, such as lifting aids or trolleys, and ensuring that loads are stored at a safe height and in a manner that minimizes the need for awkward postures or movements. Employers may also need to provide regular breaks, job rotation, or other measures to reduce the risk of overexertion and fatigue. Thanks for watching.